Now, a truly startling medical breakthrough, one that could affect millions of people who suffer from mild depression. Right now, many of them are treated with drugs like Prozac, but there may be a better way. Researchers say an amazing herb is proving to be safer, cheaper, and just as effective as prescription drugs in treating depression. Traditional medicine is slowly holding out a hand to some alternative therapies. And as Dr. Timothy Johnson will show you, all of us may reap the benefits.
When I first met Jim, he was full of life, exciting, spontaneous, and very carefree.
It was just call Tracy up and let's just go get some cash and put it in our jeans and let's go take off. Sometimes she didn't even know where we were going.
Jim Zebrowski was an entrepreneur, the founder of a successful airport shuttle service, a man who was constantly on the go.
He was fixing everything and getting things done and making things happen, and then he just stopped.
6 years ago, soon after Jim and Tracy were married, Jim sold his business and got embroiled in a legal battle with the new owners. The troubles tore him apart.
Some days I wouldn't even get up out of bed. Literally wouldn't get up out of bed. Some days I wouldn't even take a shower. I mean, it was terrible. It was not my lifestyle at all.
He would just kind of tune himself out from everything. Myself, the job, just reality.
Jim went to see a psychiatrist who told him he was suffering from depression. Some 18 million Americans experience depression in any given year. Sometimes it's triggered by a particular situation, as in Jim's case. For others, like Truan Bergen, it's a lifelong struggle.
It's as if I'm surrounded by a thick plate of smoky glass, and I can see everything that's going on around me, but I am detached from it. I'm separated from it. I can't feel it.
Truan, now 48, says that in spite of a successful career and 2 wonderful children, since her late teens, she's felt sad, distant, depressed.
The actual feeling is as if I had stones in my heart. Friends of mine that would try to talk to me about this would say, well, what are you feeling? And I would say, nothing. I feel nothing.
The pharmaceutical industry has spent millions and millions of dollars to develop effective antidepressant drugs for people like Truan and Jim. Drugs like Prozac, Paxil, Zoloft, to name just a few. In fact, last year, Prozac was the 3rd most popular prescription drug in this country with sales of $1.7 billion. But what if there was something as effective as Prozac, but without its side effects? Something you could get without a prescription for less than 1/4 of its cost? Well, some doctors say there is, namely this herb with the strange-sounding name of St. John's wort. In Latin, it's called Hypericum. They say this herb could revolutionize the way we treat depression in this country.
We're going to find that for at least the 2/3 of the 18 million people in America suffering from depression, 12 million people, probably most, if not all of those, will be taking this. Will be taking Hypericum.
Dr. Harold Bloomfield is a Yale-educated psychiatrist and best-selling author who came across St. John's wort while researching a book on depression. He was so impressed, he wrote another whole book just about the herb. He says he's recommended it to several hundred patients with very positive results.
Hypericum now deserves to be a first-line treatment.
So in the patient with mild to moderate depression, this would be your drug of choice?
Absolutely. Absolutely.
One of the patients Dr. Bloomfield suggested it to was Jim Zebrowski. Jim had tried one prescription antidepressant after another, but gave them up because of disturbing side effects like anxiety, sleeplessness, and loss of sexual desire. He was willing to try the herb, which was available not by prescription, but in the health food store.
It just gradually grew into a nice, comfortable zone for me, where I could deal with a lot of things a lot better, especially with her.
Yes.
Jim's been taking St. John's wort for 6 months.
He's back. He's back. We're actually getting out together, and he's thrown himself into his job. We have another baby on the way, so things are good. Things are very good.
If you want to get the things out for salad, that would be great. Okay.
Truan Bergen, another patient of Dr. Bloomfield's, said she too felt better after just a few weeks.
I'm taking the St. John's wort, and I started to feel just, I guess, normal. I felt great. And one day I had dropped my daughter off at school, and all of a sudden I just felt like this explosion of sunshine. And I thought to myself, gosh, this is what I think most people, normal people, feel, finally. This is what it means to feel good.
So what is this herb that has the potential to shake up a multi-billion-dollar antidepressant drug industry? Well, it turns out to be a plant with bright yellow flowers that grow wild in the western United States and much of Europe. It usually starts to bloom this week during the traditional celebration of St. John's Day, hence the name. Wort, by the way, is an old English word meaning plant. The flowers and leaves are harvested, then dried and processed into a powdered extract. The powder is shaped into a pill, coated with sugar, then dried and packaged, ready to go. In Germany, St. John's wort is now the leading antidepressant, outselling Prozac 20-1, and it's on the rise in other European countries too. In this country, it's even catching on in the heart of the traditional American medical establishment, Harvard Medical School. Dr. Michael Janicki, who teaches psychiatry there, says he first heard about St. John's wort 4 years ago when the leading German manufacturer of the herb asked him to publish their studies as a supplement to a medical journal he edits. Janicki was skeptical.
And I said, well, I'd never heard of it, and I didn't really think we'd be interested, and I knew about all the fad things. And they says, well, what can we do? I said, well, send me some of the papers. You say you have a lot of papers, send me some of the papers. And they sent me about 30 papers. And I read actually every one of them, and it was fascinating that it did seem that in mild depression there was some evidence that this would be a helpful drug.
Janicki published those studies which showed that St. John's wort was significantly more effective than a placebo in treating depression, and similar in effectiveness to standard antidepressant medications, but without their side effects. So here's the $64 billion question. If this herb, St. John's wort, appears to be as good as Prozac and other similar drugs for mild to moderate depression, it has fewer side effects, it clearly costs much less, why shouldn't we just switch everybody who are taking those drugs to this drug in this country?
Because the drug companies would never fund another one of my studies. That's a very good question, and I think until we have more data, this would be premature, obviously, to recommend that. But if we have more data and it turns out that it clearly is effective and we can document that and the side effects are much less, I suspect that we might, in a few years, end up like the situation in Germany, where this could possibly be the #1 prescribed drug in the country.
So if I'm one of the drug companies that makes these popular antidepressant drugs, the Prozac family of drugs, I'm shaking in my boots. I'm going to lose a huge area of high-profit drugs in the future.
Undoubtedly, despite all of the advertising dollars that are spent by pharmaceutical companies in this country, I think we're going to find that Hypericum is going to become the leading antidepressant.
St. John's wort even seems successful in one of the most difficult groups to treat, adolescents. Maria Carlson is an active and vivacious 17-year-old who just 2 years ago was talking about ending her life.
It was two sides saying, you should kill yourself, you shouldn't kill yourself. You should kill yourself, you shouldn't kill yourself. And I couldn't decide what to do.
But you seriously thought about it, even thought about ways of doing it?
Yeah.
Maria's mother, Janet, says a happy, lively childhood came to an abrupt end when Maria started high school. She became withdrawn, started drinking heavily, and lost interest in the things and people she once cared about.
To hear your child talking about they don't want to live, they'd rather be dead, it's the most difficult. It's just so difficult.
Janet sent Maria to a treatment center where she was given the antidepressant Paxil. But Maria says the drug made her jittery. She couldn't sleep. And Janet says the mood swings were getting even worse. Janet had heard about St. John's wort, and she convinced Maria to wean herself off the Paxil and try it. Gradually, they started noticing a change.
Yeah, I remember saying one time, I feel like myself. It was so weird.
Maria's been taking St. John's wort for the past year.
She feels better about herself. She's doing her music and sports, and her whole life is different.
So you're both believers in St. John's wort?
Yeah.
Yes, definitely.
So what do you say to all the doctors listening to this, our colleagues, the people we went to medical school with, who are sitting here saying, oh, but it still sounds too good to be true?
I would say that Hypericum is the most well-researched of any herb in the world. It's almost the poster herb, the poster child for an integration of, quote, alternative medicine and scientific modern medicine, which is really what we want.
Most doctors in this country don't know much yet about St. John's wort, although sales at health food stores are on the rise, and even mass market chains like Walmart are getting into the act. But if studies in this country bear out the results in Germany, this could be just the beginning for the little yellow flower with the funny-sounding name.
Tim, I think this is one of the most important stories that we have done in years. But let me ask you something. If it's good for mild or moderate depression, should all of us take it and just feel better, even if we're not depressed?
You mean like a preventive vitamin?
Yeah.
No, I can't recommend that. There's no evidence that it makes normal people feel any better. And I certainly wouldn't waste the money or take any chance if I was feeling normal by taking something that appears to be safe, but we, don't know about the long term.
Now, if you're taking a prescription drug, I mean, like Prozac, should you stop and start to take this?
Certainly not on your own. First of all, this drug has not yet been studied in severe depression, and the drugs that work for severe depression can be life-saving. Secondly, if you are truly mild or moderate in the depression level, you may want to talk to your doctor about weaning off of this and starting St. John's wort, but you want to make very sure that you do it under careful supervision, that there are no other drugs you're taking that might interfere. So I wouldn't even attempt that without a doctor's supervision.
But a lot of doctors, I'll bet, don't know about this herb. And how do you know about dosage?
Well, that's a very important question. We point out that they don't. And what I would recommend is Dr. Bloomfield's book. It's a practical source of dosage and information that both you and your doctor can learn from.
Ah, this is awfully important and very good to hear about. Thank you, Tim.
I've written the name down. There are days. Thanks, Tim. Next on the program, sex.